How do you know someone does not have schizophrenia even when they're experiencing hallucinations or delusions? A lot of people don't realize this, but ruling out schizophrenia is just as important as diagnosing it. Hi, I'm Jeffrey. I'm a licensed therapist, and part of my job is diagnosing and treating mental health conditions. But an equally important part of my role is being able to rule out certain conditions. And when it comes to schizophrenia, that's extremely important and also one of the most challenging diagnoses to get right because the stakes are high and the symptoms overlap with several other disorders. So, what are some of the indicators that someone does not have schizophrenia, even if they're presenting with hallucinations or delusions? The first indicator is the duration of symptoms. For a schizophrenia diagnosis, the disturbance needs to last at least 6 months, and that includes at least 1 month of clear psychotic symptoms like hallucinations or delusions. If the entire picture hasn't reached that 6 month mark, they would not qualify for schizophrenia. There are related diagnoses that depend on duration. Schizophreniform disorder applies when symptoms last 1 to 6 months and still meet full criteria. Brief psychotic disorder applies when symptoms last less than 1 month. So, if someone meets the full criteria but the duration is under 6 months, you would not diagnose schizophrenia even if the symptoms are severe. The second indicator is when hallucinations or delusions only occur during manic episodes. If the psychosis shows up only when someone is manic and disappears outside of those episodes, that would be bipolar 1 disorder with psychotic features. However, there's an important distinction. If psychotic symptoms also occur outside of mood episodes, then we start thinking about diagnoses like schizoaffective disorder or schizophrenia, depending on how much of the illness is spent in mood episodes versus psychosis alone. The third indicator that someone does not have schizophrenia is when hallucinations or delusions are the result of a substance, medication, or medical condition. If the symptoms resolve once the substance is out of the body or the medical condition is treated, then the accurate diagnosis would be substance medication induced psychotic disorder or psychotic disorder due to a medical condition, not schizophrenia. So, those are some of the main indicators that someone does not have schizophrenia, even when hallucinations or delusions are present.